medical graduates. So I want to first thank Career Guidance Unit of Rajarata University of Sri Lanka for supporting me to organize this program. And also, I like to thank Professor Anjinda Silva, Professor Kosala Veerakon, and our Dean Sir, Dr. Janaka Pushpakumara, and Professor Sunet Agampodi for the guidance given for us to organize this event. So we will be starting this program because we have a tightly packed schedule. So our first speech will be on life perspectives of a doctor, conducted by Dr. Janaka Pushpakumara, the Dean and also Senior Lecturer in Family Medicine from Faculty of Medicine and Allied Sciences, Rajarata University of Sri Lanka.
All right, thank you, Dr. Aravi. Then I will share my slides. Yeah, good afternoon, and so sorry about the 5 minutes delay. So I was at Professor Unit. You might know that we are a little bit busy with this SLMC accreditation process. Because of that, I had to visit Professor Unit today morning. So anyway, so again, good afternoon and welcome to the Career Guidance Program arranged by Faculty of Medicine and Allied Sciences. And we will try to have a second one with more clinical orientation in coming few days' time, if time permits, which we'll see. Right, so anyway, I'm not going to take more than 10 minutes, definitely. So, but this is something we can talk days, weeks, and months, because each and every level we face a lot of issues daily. So, so this life perspectives of a doctor is an important thing. Here, actually, I'm planning to cover two things. So, not really I'm doing anything. I'm going to let you think about two things. So first thing is how to be a good doctor. Second thing is work-life balance. So okay, we'll try to figure out some things, few things related to how to be a good doctor. So I have included this good doctor within inverted commas, because it's very difficult to define what good doctor means. So it's something very vague in a way, but it's definitely very important to us as professionals and to all all the human kind, because one day someone might become a patient. So definitely someone might be a patient. So so good doctor is an important concept. So if you want me to elaborate how to become a good doctor and what should I have, so definitely there are core requirements. First thing is competency. You should be a competent practitioner. Now, I know internship, successful completion of 1 year internship. Then you should get the registration at SLMC. So that is the basic requirement. Then after that, depending on your interest, you can do postgraduate studies. And I request you to do some type of postgraduate degree. It could be diploma, it could be MSc, it could be MD, it could be PhD, it could be MPhil, whatever. Because it's widen up your horizons as well as it's widen your competencies. Then the second thing is ethical practice. That is a core requirement. You must adhere to medical ethical principles. Right? I believe that our graduates do have very good attitudes, and about this disruption. So, you have been in Anuradhapura for several years. So that's Anuradhapura, right? That's Anuradhapura. So that's how we, right. Anyway. So, we were talking about these demands. So as a community, again, there are a set of demands. Again, as a society, the people do expect various things from a doctor or practitioner. So all the other things matter you to become a good doctor. So, so if someone asks you to list out what are the good things or good characteristics of a doctor, and what should you should have. So you can do a simple exercise. So just think about that your father or mother is visiting a doctor, or he or she has a illness. So, and you are planning to bring one of them to a doctor. So what are the characteristics that you are looked into? What are the things really you are caring of? So those are the features of a good doctor. So just think about your parents, your siblings, your relatives, and how you care about them, and how you select a practitioner or doctor to get them treated. So those are the things that you should have within you. Right. We'll move to the next section. That is work. Anyway, I have taken, time is passing. So I will do it very quickly. So if I ask you to describe who are you and what are your roles throughout your life in different stages, you do have different answers, right? When you were a child, right? When I ask who are you and what are your roles, so you have a different answer to today's answer, right? And even within next 5 years, only not really within next 5 years, just after starting your internship, if someone asks who are you and what are your roles, you have a really different answer. And again, after you taking your post-intern appointment, again, you have a different set of answers. Likewise, you do have different roles. And at the same time, you are acting on different roles. You may be a father, you may be a husband, you may be a wife, you may be a relative to someone, you may be a cousin brother or cousin sister, and at the same time, you definitely be a doctor. So you do have a lot of roles. But believe me, with the time passes, complexity of your roles increase. There may be dips in between, but until you rest in peace, your roles are getting more complex. So you have to prepare yourself to face those complexities or complex roles, right? So it is important to understand that work-life balance is not a problem. It's something we have to face. It's not really a problem. It's something you must attend to regularly using multi-part strategy, right? So basically a problem have solutions, but there's no simple one-step solution to work-life balance, right? It's a dilemma. So you need this multi-part strategy to face it, right? Just one example. So just imagine that you live with an 800-pound silverback lowland from for a moment. This is a wild gorilla. He is not a circus animal and doesn't know single trick. Imagine how much of your house this gorilla would leave you and your family. You would be relegated to just outside the edges of each room, and he would make a mess whenever he wanted to. So your choice to be a physician or doctor, that created this gorilla, right? The gorilla is your career. The house is your life, right? And how wild the gorilla depends on your future career selections, right? What you are going to be in future, right? What specialty you are going to do, right? Whether you are going to join the university or health ministry, or whether you are going to go abroad, leave the country. So it depends. However, the thing that you want to do is gorilla taming, right? Hila කරගන්න ඕනේ. ගෙදර ඇති කරන්න පුළුවන් level එකට. All is not a lost. Gorilla can be house trained, tamed, and shown healthy boundaries. It's your job to do this for your family, right? So to do that, I found a very interesting article. So this is the article. So I mean, it's a perspective written by Dr. Drummond, and it's titled as "Prevent Physician Burnout for Work-Life Balance." So it's a tool-like thing. It's a very simple tool. What you all need to have is just a calendar and some color pens or color painting sticks and your smartphone. Right? So it's up to you to read this small article, right? So it's anyway there, and it's on web. You can get the PDF. So few steps you can practice it. Anyway, so I'm not going to take much more time. That anyway, we have 30 minutes. Good luck for your future endeavors. Thank you. And at the same time, and Rajpaksha and team giving me this opportunity and arranging this important workshop for you. Thank you.